Good evening, virologists. I'm Alexander, and in the next few minutes, I hope to bring you a short, informative, hopefully entertaining presentation on a paper I chose on failures in the Milwaukee protocol. Just start with a few small facts about myself, since I'm not going to present in front of a class. I'm 24 years old, doing a master's in BMS, currently work in surgery, applying to medical school in June. That's about it. This paper in particular, the Milwaukee protocol, has interested me a lot since I first read about it many years ago, and it is a useful tool on the sort of future of science, and it tells us a lot. And these independent case studies are useful for physicians when they're faced with scenarios that they haven't seen before, and a lot of the independent case study reports that are published, and papers that are published rather, there are situations like this where a physician comes across a novel situation and tries something, and it goes one way or the other, and they provide a report about it, and it gets published. These can be built upon by future cases, and in the end, either refuted or confirmed. These things take time, and this is sort of how scientific ideas, especially clinically nowadays, can get created and tested. Obviously, there's other ways of doing this as well, but these are more for sort of on the cuff attempts to save a life when everything else is not going well. The whole principle behind this paper, the inducing the coma side of things, I've worked with anesthesia and around anesthesia for a couple of years now, and is a real interest of mine. How you're inducing a coma for a patient's benefit, and one of the things that attracted me to this paper. As we've seen Dr. Graham recording in class lectures for us, the Milwaukee protocol started back in 2004 with this patient Gianna, and she was bitten by a bat and did not receive any rabies vaccine prophylactically after the bite. I'm assuming because there was no reason to suspect there was anything wrong. And unfortunately for her, rabies symptoms developed a month later, and it was too late to treat her with the sort of prophylactic antibodies that they often do to rabies patients, suspected rabies patients, and her body had already developed a strategy towards the virus. So doctors came up with an idea to try and save her life, where they would induce a coma, treat her with large doses of antivirals, and aggressively support her care. After a few days, it was clear that there was a chance that she'd live, and things slowly began to mend over time for her. They would say that there was some success. There was a large success. She's considered the only rabies person alive who's fully survived rabies, but she's not regained every function. There's still some things that with her she had to relearn most things in her life. She had to relearn to walk and talk and eat. But she's live. She's, as we saw in the class lecture notes, she's graduated from college and she's got a job. Even at the time, there were some, after the case study report got published, there was some concerns because no virus was ever actually recovered from her body to confirm that she had the fully virulent rabies. And I believe in 2006, so pretty soon after this protocol came out, they attempted to try it with a small boy, and it failed right away. So there was initially some scientific concerns there. When I selected this paper, because it was it talked about what I wanted to discuss, there was a lot of similar articles, and sometimes you get a good feel for a paper if you look at the similar articles. And as you can see from this image here that I screen captured, all the extra articles similar to the one I'm looking at, which is failure of the Milwaukee protocol, failure of therapeutic coma, failure of therapeutic coma, current and future approaches to the therapy of human rabies. There's not any, it seems so far, scientific reason that this is successful technique. Multiple other papers and case studies have all arrived at the same conclusion. Different countries, different patients, different times of approach, lots of different ideas, even different ways of applying this protocol, which includes the previously mentioned three main ideas of coma, antivirals, and support care. When we consider scientific progress, it depends upon a technique's ability to be performed successfully and reperformed and again in a laboratory, sometimes when it comes to more classical techniques and discussion, but that's how scientific advancements are made. And at a certain point, if a certain subject matter or a certain scientific technique is not able to be reproduced in a lab, it no longer can become no longer can be a serious idea, theory slash, in this case, protocol. And that is it. There is an interesting question there. When do we abandon an idea? And we'll come back to that at the end. This paper, it was basically a critical appraisal. I've grabbed a small part of the paper and thrown it at the bottom of the slide, where they just talk about why this paper was written, and it was because there was scientifically grave concerns with the Milwaukee protocol, and they've decided to look at all the test subjects and all the times it's been used since it was used in its first case in 2004. They summarized all known patients treated with the protocol, and they reviewed all the literature that's been published surrounding its use in rabies encephalitis cases. Everything from 2005 to August 2015. There was one caveat. Not only did they exclude animal studies, but they only took cases that were sort of where the patients were treated in the same sort of way. So where a patient had rabies encephalitis set in and no part of the Milwaukee protocol was used, or almost no part of it was used, they did not include that study. I didn't get a look at any other studies where this has happened, but as far as I'm aware, there's been no success anywhere else anyway, so I don't think it's very relevant. 31 human cases were initially found, and if you look at the results on here, you'll see there are only 29. Initially, 2 of the results were sort of struck off because the data on those was quite unknown. Of the total of 29, as you can see, people all died either immediately or shortly thereafter. The 2 cases, numbers 8 and 14, that did survive had extremely low quality of life due to brain malfunction / injury, and they did die soon after. 12 cases, which is 41% of them, received the major components of the Milwaukee protocol, which is the coma, and then the ketamine, which is basically it keeps the brain in a sort of induced state. There is variations across different treatments, whether it be in the UK, Canada, and different states and different countries have their own sort of ideas on how to proceed, and I'm sure different physicians do towards the end at some of these later times. Like you see with case in 2012, a couple later cases. By that point, I think physicians were fairly sure that doing the normal procedure, the normal way, probably wasn't likely to survive, so they would tweak something, try and change it. But sadly, to no avail. There was a lot of discussion in this paper about the different types of treatment under the Milwaukee protocol. The Milwaukee protocol itself is quite rigorous, and there are certain things you do and certain drug treatments you go through and certain procedures they do. And the paper itself pointed out that current treatment under the Milwaukee protocol differs from the clinical recommendation for treatment of various symptoms. One of the most major of those being cerebral vasospasm. These days, the treatment for that symptom by itself for other reasons, I'm guessing other encephalitises, if that's a word, is just different from what the Milwaukee protocol suggests. And so at this point, it may even be the case that the straight clinical treatment for certain parts of this whole protocol need to be reviewed and checked and brought up to standard for treatment at various places. The clinical recommendations for the coma, the NMDA receptor antagonists, and the treatment of cerebral vasospasm are all supported by little to no scientific evidence in the literature currently. That was a major part of this paper. They went into a lot of detail. clinical detail about these various clinical recommendations, and it was over my head, quite a bit of it, and it's not particularly useful. Obviously, if you can read the paper yourself, if you want to look into further detail, but it's a lot more of a clinical, scientific discussion. And the conclusion they definitely found was that very little scientific evidence in the literature currently supports what they're doing. And so that, for me, is a large part of why I think that this protocol needs to be overhauled or just not used at all now for the foreseeable future. We'll touch on that in the next slide here. Conclusion that basically, despite initial hope and enthusiasm for this protocol when it was first published, every subsequent case that meets certain standards of rabies virus virulence has failed. And that's a big sentence to say, in the sense that it means that right now there is no cure. If you get past the stage where rabies has gotten into your cerebral, your central nervous system, this one case with Jenna definitely has question marks over it because she survived, because it's never worked on anyone since. Dr. Graham's slides for lecture did mention the possibility that she was treated or had been bitten with a rat that had an attenuated strain. Maybe it wasn't the full rabies virulent strain. That is at least thought to be the case now by certain scientists who work with this. The main reason the protocol has been so successful in being tried is that there's just no other ideas. As we sort of saw a little bit earlier, doctors have been working on tweaking the protocol a bit to see if they can improve upon it, but zero success. And as we talked about in class, the only real future for a possible cure for this would be looking at it with serious animal testing. And as of right now, there is definitely not the case numbers seen in the United States / the Western world to spend the money and time it would take to open that up, even if there was a serious likelihood of finding a good treatment protocol. Considering how few cases the Western world sees of rabies and how few of them get to this area, it's just unlikely to ever be undertaken. There is obviously, as we saw from the class lectures, the possibility that animal hospitals just don't want to be working with rabies. But with some of the BSL labs that in development, I'm not thinking it would be impossible in the future, but I just don't see it likely, considering how few people need this cure that's out there. I definitely think myself that going forward, the doctors need to sort of abandon the Milwaukee protocol. 29 cases since, 0 successes. They could say 1 in 30 if they added in the initial case, but that's a big question. There's a big question mark over that. I would definitely just start by going back to clinical recommendations for treatments of the various symptoms. There's definitely a future with some hypothermic work in other papers. There's a lot of literature out there. A lot of scientists have guessed a lot and not been able to test their theories. Anyway, that's all from me. I hope you enjoyed. Have a good night and good luck studying for the final exam. Thanks.